Today we are going to talk about Inbrija. This Inbrija is a orally inhaled levodopa or levodopa inhalational powder. The brand name is Inbrija. What is this? It's a inhaler for Parkinsonism. Levodopa in the powder form. So generic name is the levodopa inhalational powder. Brand name is the Inbrija, and the drug class, it's an anti-Parkinson agent or dopamine precursor that we know. Levodopa is a dopamine precursor that we all know, but now it is available in the inhaler form, levodopa inhalational powder, and the brand name is Inbrija. It is not available in India, it is available in the United States, and we'll see what is this Inbrija and how it is used. This Inbrija is a prescription medicine and it is used to treat the off symptoms of the Parkinson disease. It is used to treat the off symptoms, on and off symptoms. So in Parkinsonism there is a off symptoms. So in that particular period we can use this Inbrija, which is nothing but the levodopa inhalational powder. This Inbrija can be used along with other medications. It is used along with other medications, and Inbrija belongs to the class of dopamine precursor. It is nothing but the levodopa, only in the form of powder form or inhalational form, which is the anti-Parkinsonism drug. This Inbrija consists of dry powder formulation of levodopa for oral inhalation with the Inbrija inhaler. This Inbrija is a dry powder formulation of levodopa. We generally use levodopa in the tablet form, right? But this is the inhaler in that we can use the dry powder formulation of levodopa for the oral inhalation, and we have to use this Inbrija with Inbrija inhaler only. This inhalational powder is packaged in white hypromelose capsules. It is packed in the hypromelose capsules. Each capsule contains the spray dried powder of 42 milligram levodopa as an active ingredient. Active ingredient will remain same, levodopa 42 milligram. It is available in the capsule as a spray dried powder. The active component of Inbrija is levodopa, which is an aromatic amino acid. This levodopa has a molecular weight of 197.19 gram per mole. Molecular formula is C9H11NO4. This levodopa is a white to slightly off-white powder. It is available in the powder form, half-white to slightly off-white. It is readily soluble in the formic acid, slightly soluble in the water, practically insoluble in the ethanol and diethyl ether, and it dissolves in the dilute hydrochloric acid. Now, this is how it looks like the Inbrija inhaler. This Inbrija inhaler is a plastic device with a blue body, as you can see, with a blue body, blue handle, blue cap, right? Then there is a white mouthpiece which is used for inhaling levodopa powder, right? Blue handle, blue cap, there is a white mouthpiece, and there is a capsule chamber, as you can see in the picture. There is a capsule chamber. The Inbrija inhaler is a breath actuated by the patient. It's a breath actuated by the patient. Under standardized in vitro testing conditions, the Inbrija inhaler delivered 36.1 milligram of levodopa, which is the immediate dose for the 42 milligram capsule from the mouthpiece. When we use 42 milligram of capsule, it will emit 36.1 milligram of levodopa. Now, where we use this? We use this Inbrija in the intermittent treatment of off episodes in patients with Parkinson disease, treated with carbidopa and levodopa. Those patients who are on syndopa which is a fixed dose combination of carbidopa and levodopa, in that particular patients when there is off episodes. When there is a off episodes in that particular period, we can use this medication Inbrija, which is available in the powder form for the inhalational purpose. This how the dosage and administration. Inbrija capsules are for oral inhalation only, and they never should be chewed, or they never should be swallowed. It is only for the oral inhalational purpose, and this should be used along with Inbrija inhaler only. These Inbrija capsules are for only oral inhalation, and it should be used along with Inbrija inhaler. Now, what is the recommended dosage? Inbrija should be taken when symptoms of an off period start to return. Whenever there is some intermittent off symptoms or off period is there, you can use this drug. The recommended dosage of Inbrija is oral inhalation of the content of 242 milligram capsules, which is equal to 84 milligram as needed, up to 5 times a day. What you can, what are the recommended doses of Inbrija? 242 milligram capsules means 84 milligram as needed. The maximum dose for off period is 84 milligram. The maximum daily dosage is 420 milligram. You can take up to 5 times a day. Inbrija has been shown to be effective only in combination with the carbidopa and levodopa. It is effective only in combination with carbidopa and levodopa. How will you store and handle? Inbrija 42 milligram contains foil blister, as you can see in the picture. There is a foil blister strips of Inbrija, that is a levodopa inhalation powder, white capsule with two black bands on the body, and A42 in the black on the cap, and one Brisa inhaler. So this is how it looks like. It contains the foil blister strip of Inbrija levodopa inhalation powder, in which there is a white capsule with two black bands on the body. As you can see, there is a two black bands on the body, A42 in the black on the cap, and one Inbrija inhaler. Carton containing 4 Inbrija capsules, one blister card containing 4 capsules, and one Inbrija inhaler. Now, what are the adverse effects that uh, we can see with this device or with this inhaler? Falling asleep during activities of daily living and somnolence. There is a chance of somnolence and falling asleep. There is a withdrawal, emergent hyperpyrexia or confusion, hallucination, psychosis. There is impulse control or compulsive behaviors. There is a dyskinesia, bronchospasm in patients with the lung disease. So all these things can be seen with this levodopa inhaler powder. So what we have seen, the Inbrija, which is available in the form of inhalational form.